Hi everyone, I am Dr. Sheila Nazarian. I am a board certified plastic surgeon in Beverly Hills, and today we are going to talk about frequently asked questions about labiaplasty. I know that's your favorite topic, so here we go. Question number one, who is a good candidate? So there's two different types of candidate for labiaplasty. There's the people that have a functional problem, meaning pain during intercourse, while riding a bike, chafing, that sort of patient. And then there's the patient that's just sort of like an aesthetic candidate. They don't like the labia minora hanging out beyond their labia majora, and they just sort of want a cuter situation happening down there. Okay, question number two, local or general anesthesia? 99% of the time I perform this procedure under local anesthesia. You're completely awake. We're talking about our childhood and our lives the whole time. The only time I'll do it under general anesthesia is if the patient really just asks me to do it, or if I'm doing like a tummy tuck or a breast augmentation at the same time while you're asleep. I figure I'll just do it at the same time. Question number three, is there nerve damage and can I lose sensation? So obviously the technique and your surgeon's experience is really important while answering this question. I've never had anybody with nerve damage or sensory loss, but I think it's because I stay really posterior when I'm doing my cuts. I don't go anywhere near the clitoris, so that's sort of been a good technique for me. The healing process, aftercare, when will I look normal? Is there bruising and swelling and scarring, and how much to ice? So typically after a labiaplasty, I have you sort of take it super easy for 3 days. I have you just binge on Netflix or something, and you're gonna sleep on your couch with a pillow under your butt to elevate the pelvic area. And I'm gonna have you ice over a towel for the first few days. So if you have it done on a Friday, just expect that weekend to be following up with your favorite Netflix. As far as bruising and swelling, there is some bruising and swelling. For the first 3 days, that sort of tends to increase, which is why we want you icing the first 3 days. After the 4th day, the swelling will start to subside. How much to ice? As much as possible in the first 3 days. So question number 5 is, when can I work out again? I always tell you within the first 2 weeks you're still at risk for bleeding, so you kind of want to smell the roses, maybe go for light walks for the first 2 weeks, and then after 2 weeks you can sort of ease back in. Now, do I want you going and doing 𝐸𝐵𝐻? No, because that's direct pressure on the area. I do want you to maybe go for a light jog, but really listen to your body. If something hurts, you're going to back off. When can I have sex again? This varies as well. I usually tell people 4 weeks. I've certainly had patients confess that at 3 weeks they just couldn't help themselves and everything was fine. But again, I think this goes in the category of listen to your body, and if it hurts, stop. What not to do after surgery. So you're gonna be numb for like 4 hours after surgery, and it's gonna feel like you had nothing done. That doesn't mean you can go to the bank and Whole Foods and run errands, okay? So you don't want to be very active right afterwards while you're numb, and you don't really have the sensory feedback from down there letting you know if you're doing too much. So what I really like my patients to do is sort of, you know, go straight home and ice and elevate their pelvis and just sort of take it easy. So maybe you've already done your grocery shopping, maybe you already, you know, have cleaned out your closet, and so, you know, you're sort of prepared that you can just go home and rest for a few days. What are the risks and complications? With any surgery, you know, there's a risk of scar, bruising, pain, blood collection or fluid collection, and having a little bit of asymmetry and having to take off a little bit more. Do these things happen often? No. And we give very specific instructions of what you can and can't do after surgery. And so we've been very lucky, I guess, in this area. Can I do the procedure if I'm on my period? Absolutely, I don't care at all. Actually, I think it's great because there is some spotting after the procedure, so if you're on your period, you won't even notice that. And then laser labiaplasty versus different techniques like the wedge. There's a few different techniques of doing labiaplasty, the most common ones. One of them is just to cut or amputate, and I don't like that one because the scar is right along the edge and there's a risk of taking off too much. So it's not often that I perform it that way unless the edge of the labia is just not attractive at all and we really do just want to cut that out, and we think that a line along the edge is going to be even more attractive than that. There's the wedge, which is my favorite, which basically maintains the natural contour at the edge, and it creates the scar inside of, going into the vagina. And so it's a very unnoticeable scar. The labia looks very natural, and I don't know, it's just my favorite. I think it gives the best aesthetic outcome as well. And then there's another one where you sort of take a little bit of the inside off and then sew it down. It's called de-epithelialization method. Again, I think there's certain applications for this, not my favorite, but because there is a scar on the outside that can be noticeable, but those are like the 3 most common ones. Now, whether people use a laser to do the surgery or whether they use a knife to do the surgery, I don't think that makes much of a difference. I think that's just surgeon's preference. So any way your surgeon can get the best results they can, hey, so be it. So those are the most frequently asked questions about labiaplasty. If you have more questions, certainly feel free to leave them below, and we'll make sure to answer them for you.